Hello, my name is Shalana Providence, Strategic Planning and Communications Manager attached to the Georgetown Public Hospital Corporation, GPHC. The Ministry of Health is turning the spotlight on another epidemic that has had an overwhelming impact on humanity, families, the public and private sectors, and has undermined productivity and interrupted schooling. Reflectively, this particular epidemic has contributed to stark levels of social marginalization and instances of stigma and discrimination against many vulnerable populations such as sex workers, men who have sex with men, people who inject drugs, transgender people, and migrants. What is this epidemic, you may ask? We are talking about HIV/AIDS. Over the last 32 years, the world has designated and observed December 1st as World AIDS Day. On this day, attention is on leadership, accountability, hope, action, empowerment, human rights, prevention, and discrimination. Those keywords have been included in one way or another in the focus and vision of the yearly observance of World AIDS Day. That said, this year's theme for World AIDS Day is Global Solidarity, Shared Responsibility. As part of our activities in observance of World AIDS Day 2020, the Ministry of Health has decided to place the spotlight on the preventative aspect of HIV, more specifically, the use of pre-exposure prophylaxis or PrEP. If you are not aware, PrEP or pre-exposure prophylaxis is a medicine recommended by the World Health Organization, WHO, for use by people who are at substantial risk of contracting HIV, such as people who inject drugs, and persons whose sexual partners are HIV positive or have an unknown status.
In the context of HIV, it is really preventing the infection from happening. Before you even get the exposure to HIV, you can actually prevent it. And that's what the essence of PrEP is.
PrEP is the daily use of Truvada to prevent people who do not have HIV from acquiring it. These antiretroviral medicines used for PrEP have been shown to be safe and effective in preventing HIV infection when taken as prescribed.
It's a way of preventing HIV infection. And so once you are deemed eligible, once you have risk, we would then be able to interview you, determine whether you are eligible for this type of treatment, and then we'll initiate the treatment. The treatment is very simple. You take a tablet a day, and we normally, in the first instance, when you're initiated, you're given tablets for a month, and thereafter, once you're monitored and everything is okay, you'll get tablets for at least 90 days. So you don't have to come into the clinic very often, but you have to maintain the regimen that you're put on, which is very easy, one tablet a day.
So there are two forms or types of PrEP that are recommended by the World Health Organization for prevention of the spread of HIV. You have what we refer to as daily oral PrEP. So this is taking one of the PrEP pills daily, and you can take it for a prolonged period, and stopping this pill will depend on a discussion with your physician and actions that you would have taken to reduce your risk of contracting HIV. We have to stress here that, and I think I need to include this point here, that PrEP doesn't work alone. It is not a magic bullet or pill. So you must also encourage condom use for our key population, the use of lubricant, and also we must do assessment for other sexually transmitted infections, as well as encourage those persons to reduce their risk by reducing the number of partners or sexual partners that they interact with. So this daily PrEP, oral daily PrEP that I'm referring to, you take it within the first 7 days of using it. The drug will reach its maximum amount in the body, and that will allow it to become very effective in preventing the spread of HIV. The other form of PrEP that we have is what you call PrEP on demand or event-driven PrEP. It means that this is the form that a person will take in preparation for going out on a recreational activity that they think that they may engage in a sexual act. And so it means 2 to 24 hours before you intend to have the sexual act, you have to take 2 pills instead of 1. And then you have to follow up with a 3rd pill 24 hours after you would have taken those first 2 pills, and then a 4th pill 48 hours after you would have taken the first 2. This requires a lot of discipline, and the studies have shown that this form of PrEP works most effectively with men who have sex with men. So it's not really for every person who is identified as being at substantial risk and requiring PrEP.
With regards to the introduction of PrEP in the Caribbean region, the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP, was instrumental in taking the lead by fully endorsing the WHO's recommendation, which called for PrEP to be offered to all population groups. Noteworthy, Guyana was among the first to develop and implement PrEP programs with buy-in from civil society organizations.
Guyana is one of those countries that have not really rolled out PrEP in a comprehensive way. And that's why we are examining this whole use of PrEP, and we want to make sure that in Guyana we have a comprehensive PrEP program, because we believe this is going to prevent many more infections from happening.
Guyana would have started providing pre-exposure prophylaxis in 2019. And during that time, the focus was generally on what we refer to as serodiscordant couples. So these were persons who are in a relationship where one party is HIV negative and the other is positive. And so it is the HIV negative partner that benefits from the PrEP, which again is pre-exposure prophylaxis. And this is one of the preventative measures for preventing the spread of HIV and AIDS. And so in looking at this measure, it is one of the most scientific methods that is existing as it relates to preventing the spread of HIV. It is highly effective, and so it is important to us to ensure that persons who are deemed at substantial risk for contracting HIV, that they are able to access this. Based on what we notice occurring in the Caribbean region, Guyana is encouraged, like many other countries in the Caribbean, to move beyond looking at serodiscordant couples and look at our key populations, especially our transgender women and men who have sex with men. As when you look at the HIV prevalence across the Caribbean region, you will realize that these 2 subpopulations are disproportionately affected by HIV, and therefore PrEP offers us an opportunity to be able to prevent or avert a new infection by being able to make this accessible to those groups. And so that is what Guyana is going to be looking at now, at ensuring that we're able to expand it beyond the serodiscordant couple to include our key population group, specifically our men who have sex with men and the transgender community.
Guyana's introduction of PrEP was done through a private-public partnership which saw private physicians collaborating with the Ministry of Health to provide this new preventative option.
So the public-private partnership arrangement we have is a service that we offer for HIV treatment, as well as the pre-exposure prophylaxis that I mentioned earlier. This is done through a group of private physicians across the country. If any person desires to access that service, they can contact the National AIDS Program Secretariat on 227-8683 extension 215, and we can provide to you the names of those physicians and how you can access the service through them. And so this is an agreement between the Ministry of Health and those physicians. What the cost that entails providing or accessing this service is towards the consultation fee. So in other words, the person doesn't pay for the PrEP medication that is offered, but they pay for the service that that private physician provides for them.
I started introducing or offering PrEP to my patients since last September, and that was after I had signed a memorandum of understanding with the Ministry of Health and the National AIDS Program to do a private-public partnership for HIV care and treatment. And I have to say the uptake has been very slow. So I think for a lot of people, taking a pill every day is something that they're not very happy to do. So for a lot of them, from a lot of the patients was very slow. But I have to say that this year we've certainly seen a lot more patients show interest in it. So we have a lot more patients now in our clinic who are accessing PrEP.
The public-private partnership is an initiative of the Ministry of Health that will involve private practitioners to offer pre-exposure prophylaxis and HIV care to people in Guyana. There are guidelines. The physicians who are involved in that partnership, they have to follow the national guidelines, and they will be in complete collaboration and communication with the Ministry of Health regarding the management of HIV persons as well as the people who access pre-exposure prophylaxis.
Importantly, PrEP is an additional HIV prevention option. It should not replace or undermine other effective, well-established HIV prevention interventions. However, for its effectiveness to be maximized, it must be taken correctly.
We believe that this is a very effective way of preventing HIV because if somebody is HIV positive, then they'll have to be on lifelong treatment. If you can prevent the infection from happening, then it saves in so many ways, not just money, but it prevents that person from getting sick and having to use medication for the rest of their life.
In 2012, the World Health Organization, WHO, issued guidelines for PrEP and made similar recommendations for its use among men and transgender women who have sex with men. The WHO noted that international scientific consensus is emerging that antiretroviral drugs, including PrEP, significantly reduce the risk of sexual acquisition and transmission of HIV, regardless of population or setting. In 2014, based on further evidence, the WHO updated the recommendation for men who have sex with men to state that PrEP is recommended as an additional HIV prevention choice within a comprehensive HIV prevention package. And in November 2015, the WHO expanded this further on the basis of additional evidence, stating that it had broadened the recommendation to include all population groups at substantial risk of HIV infection, and emphasized that PrEP should be an additional prevention choice in a comprehensive package of services.
We know that PrEP, like I mentioned earlier, is highly effective. And because of the fact that it has been scientifically proven to prevent the spread of HIV, and this is once used correctly, then it will equate for Guyana a reduction in new cases, which is in the incidence, and then in the long run that will result in us having less persons living with HIV. Of course, death also accounts for a drop in the prevalence rate of any country, but if you can avert new infections, then it means that you will also have less persons living with HIV. And so in that sense, PrEP will, once used correctly, once the correct subpopulation is targeted for its use, can result in a reduction in the prevalence of HIV in the country. Currently, we are offering this service through our private physicians that work with the National HIV Program, and so we are looking to place this service at one of our public sites through an extended hour clinic that we do at unusual hours in the evening to allow for persons to be comfortable to access this service in the public setting, which will be at no cost to the person who's accessing. So this is a very important move for us.
Implementing PrEP involves more than just ensuring the supply of medicines. It also involves regular HIV testing, screening for other STIs and adherence support, linkages to treatment for anyone who receives a reactive result when they are tested for HIV before starting PrEP, or who is a seroconvert, that is, who tests HIV positive for the first time while using PrEP. In an effort to ensure that all HIV services are readily available and easily accessed, the Ministry of Health is developing plans for the expansion of PrEP through the public healthcare system.
The intention here is for us to use our existing clinics. We have a network of clinics around the country, so we'll be using the existing clinics. What would happen is that a person who is desirous of getting PrEP would come into one of the clinics. They would be interviewed, they would be screened. You have to go through a bit of counseling. And you will have to, before you're placed on PrEP, you will have to do a number of laboratory tests, including checking to see your kidney functions, checking to see whether you have hepatitis, because the medication that is normally used, if someone has hepatitis, you need to be aware of it, so that once you start the medication, and if somebody wants to stop the medication, there can be some challenges. So it's good to know up front, so that when we put someone on the PrEP medication, that they can do so very safely.
We are currently in the process of working on that plan for the expansion, but we have already looked at and identified the site where we can offer that service, and because of the fact that they have all the systems in place, and this would be, you have doctors on duty, you have the consular tester that is there for that regular screening that will be required. You have your social workers that are there to provide any additional support or counseling that is required. We also have the pharmacists on board as well as the lab technician. So once the person accesses that service, every single service that is required can be given at that one visit. And so it's like a one-stop shop experience for the person who will access through our public site that we have identified. The public site also has a psychologist on duty during that time, and so it's very unique and very the setup is very much there to allow us to be able to effectively roll out this. Once we see that it works well at that site, then we can look at having it available in other regions within the country, because it's important if you're going to introduce a person to PrEP that we have all the necessary support system that is required to ensure compliance. This is for a dedicated person, a person who will dedicate to taking the pre-exposure prophylaxis pill and taking it according to how it is prescribed. So it's not just about accessing it and having it available to you, but the commitment also has to be there on the part of the patient.
As mentioned earlier, Guyana was among a few other Caribbean nations that took measures toward the introduction of PrEP. The Ministry of Health is developing steps to ensure the successful introduction of PrEP through the public system.
What we'll do, we'll introduce a document, a policy to say, well, who it is that we're targeting. In this case, our option is to go with what the WHO has put out, and that basically is for anybody who feel that they're at risk for HIV, that we should offer them the service. So we'll be following those WHO guidelines, and we'll be putting that into local guidelines. We are doing a strategic plan for HIV, and this would be one of the elements of that strategic plan.
PrEP will save cost by preventing new HIV infections among its users, thereby averting the cost of lifelong antiretroviral treatment. preventing onward transmission to others, additional cases of HIV infection will be averted, further avoiding the need for HIV treatment. People who would benefit from PrEP are those at greatest risk of infection. The impact for cost ratio of PrEP will be relatively high compared with other prevention approaches. PrEP is not a lifelong treatment. Rather, it is used during specific periods of risk. Therefore, costs are incurred on an ad hoc basis only. We must keep in mind that PrEP provides another prevention option for people at ongoing HIV risk, particularly where other prevention choices may be difficult to use consistently or when people are unable to insist on condom use. This holds true for our key populations. While the government and the Ministry of Health are committed to ensuring much needed programs and funding are in place, support and endorsement are also welcomed from civil society organizations.
We need to ensure we continue to incorporate global best practices for the treatment of HIV. One such is what we are rolling out and what is known to be PrEP. It's important, even as we try to bring that treatment to persons, the adherence to accessing and ensuring that those treatments are taken in a way that help and not hurt those that most in need. We consider all the peculiarities around what is expected and how it can be best administered, particularly to our most vulnerable populations, which are the MSMs, or men who have sex with men, sex workers, and those who most often are afraid or stigmatized when accessing services. So it is very important that with the preparation for the rollout of PrEP, that these be given high consideration.
SASOP Guyana commends the government of Guyana for expanding the provision of pre-exposure prophylaxis in the public healthcare system. This move is long overdue, and this would substantially benefit key populations, specifically sexual and gender minorities. The WHO recommends PrEP for anyone at substantial risk of HIV, and we know that PrEP is effective medicine that will prevent HIV in our communities.
When I first heard about PrEP in Guyana, I was quite excited about it because we had a discussion about it previously about other countries in this part of the hemisphere coming on board and administering PrEP, pre-exposure prophylaxis, and I thought it would be a wonderful thing, especially for discordant couples, for persons who are positive and their partners are not. But it bothered me a little bit that the first set of PrEP that was available for people in Guyana went to the private entities, meaning the private clinics. So private doctors were trained to administer that, to give PrEP to persons who needed it or persons who needed to go on PrEP. And the people who need to go on PrEP, who are HIV positive, who are accessing treatment at the public entities. And so they're people who cannot afford to go to the private entity. So we need to have PrEP at the public entities. The community that I worked with have come to me, have raised their concerns about it, have said, why can't we access it? We can't afford to go to the private entity. There is talk about expansion of PrEP to the public entities, and I'm looking forward to that. I'm hoping that it happens. It has to happen so that the people who really need PrEP and cannot afford PrEP can access it at the public entity.
Introduction of PrEP to help fight HIV and AIDS. Sex workers will benefit from that to better protect themselves from the HIV epidemic. It's another form of protection, and I think it will work.
It's a great step that the Ministry of Health has taken. I must say thanks to NAPS and the team in doing such for the country. More so the transgender community, I think this would be a great step. Mainly, we have many transgenders that are involved in sex work and what's not. Some of them are young, they're bullied most of the time that they're on the streets during their plight. So having PrEP, I think, would be a great step for them in case of their being victimized one way or the other. So I think that's very much great. And it's a great step more so for the public, general public, in dealing with unwanted sex in the act of rape and such as. So I think it's quite great.
We strongly advocate the use of PrEP, because when we look at statistics worldwide, even though there has been a decline in the incidence of new HIV infections, in 2019 worldwide there still were 1.7 million new HIV infections. So we would love to see that number reduced, and we think PrEP would be a good way to reduce it, especially if we're going to offer it to people who are at risk.
Truvada for PrEP provides 92% to 99% reduction in HIV risk for HIV-negative individuals who take the pills every day as directed. If a daily dose is missed, the level of HIV protection may decrease. It only works if you take it. People who use PrEP correctly and consistently have higher levels of protection against HIV. With this in mind, research continues into other drugs that can be used for PrEP. Guyana and the world continues to grapple with the COVID-19 pandemic and the overwhelming demand it has placed on its healthcare systems. The Ministry of Health reaffirms its commitment to ensuring that vulnerable sections of the population throughout Guyana have access to preventative medicine and care. A commitment to global solidarity and our understanding of shared responsibility will see us defeating the COVID-19 pandemic and the HIV/AIDS epidemic, guaranteeing the right to health for all. Let us all join in this shared responsibility.